Dr. Chase Larson here at Total Care Dental in American Fork, and this is Dental Mysteries Revealed, Episode 8. One of the things that I love about being a dentist is the opportunity that we have to see patients from the time that they're very, very young as they grow and develop and get older. As you grow and develop, things change, obviously. Your jaws grow, your face grows, you get bigger, you get stronger. And what we're learning is that the muscles in our body have a lot to do with how our bones and faces and bodies develop and grow. And as dentists, we're particularly obviously concerned with the jaws, with the face, and with the teeth. And one thing that we've seen over the years is that a lot of times our ability to breathe can actually have a profound effect on the way that our faces look and our jaws develop. It might seem a little bit confusing, but when you think about it, as you breathe through your nose, certain things are taking place. If you can't breathe through your nose, then you breathe through your mouth. And as dentists, we often can notice when we look at somebody whether or not they breathe through their nose or whether they breathe through their mouth. We like to see your ability to breathe through your nose. The reason is, if you can't breathe through your nose, what happens is you start to breathe through your mouth. And that changes the posture of your lips, it changes the posture of your tongue, and eventually will change the position of your teeth and the jaws that support your teeth. So when you breathe through your mouth, what happens is, as opposed to your tongue resting against the roof of your mouth where it typically sits, your tongue starts to come forward so that it can allow air to go through your mouth into your lungs. And what happens is, as a child grows and develops, if their tongue is not sitting up against the roof of their mouth, it's not putting pressure on the roof of their mouth. And so instead of developing the proper kind of U curvature that we like to see on the roof of the mouth, they start to develop a really narrow V shape to their upper jaw. And the reason that this is a problem is because it causes a problem in the way that the teeth are aligned with each other, as well as a problem with the growth of the jaws. And so a lot of times, if someone's a chronic mouth breather, as they're growing up and getting older, their jaws won't develop in the correct position. And this can make it much harder as they get older to get those teeth in alignment. It can also cause problems with tooth decay and with gum disease. If you're always breathing through your mouth tends to become very dry. You don't have the saliva that we typically produce that washes away food, that washes away bacteria and acid, and so you're much more prone to getting cavities and gum disease. So when we see you here in the office, not only are we looking at your teeth and your gums, we're also evaluating your ability to breathe properly because it has a profound impact on your mouth and your overall health. So what we'll do is we'll sit down, we'll look at you, we'll talk with you a little bit and figure out what's going on so that we can make a proper diagnosis and then can treat you. And we'll work with different providers here in our area, whether that's an orthodontist or a physician, because of maybe some enlarged tonsils or some nasal obstructions, to help you make sure that your child or you can breathe properly so that it's not negatively affecting your dental health or your development. So if you have more questions, we'd love to talk to you more about it. Come on in and we can sit down with you and talk a little bit more about it. We'd love to see you.